So again, good morning, everybody, and today is a solemn day around the world as we recognize International Holocaust Memorial Day, where 6 million Jews passed away. So please take a time to think about that. Also, it's been 321 days since this started for us, and our first case of COVID-19 on March 12th. We're in week 45. Believe it or not, we're almost going to be soon on 11 months of this, and I will say this again. I did not, in my wildest dreams, think I'd be here 11 months later still talking about COVID-19. But sadly, last night we lost 3 more Albany County residents to this COVID-19 virus. A man in his 70s, a woman in her 80s, and a man in his 90s, which now gives us an all-time record of 302 people that passed away from COVID-19 since the beginning of this. And the rate we're going, we'll be averaging over 1 person a day when we hit 12 months into this, which is sad to think about it. And I know there's still people out there that don't believe it. I know there's still people who think that this was just made up by the whatever party affiliation you're against or for, and made of politics. It's not. This is about saving people's lives, and to the families, my condolences and prayers go out to you. It's hard enough to lose anyone, but hard enough to lose someone in these tough times. And if you think early on when you couldn't give a proper send-off, a wake or a funeral, and it was private, and a lot of people chose to wait and to months later to try to do a service and still can't. My heart goes out for you. So please take the time and think of these families that are going through these difficult times. And remember, it's a marathon, not a sprint, and we'll get through this. Today, the 3 people we have lost are seniors, but we've been reporting on a regular basis people now dying in their 50s and 60s, which was alarming as I was seeing the statistics coming in, the amount of people in their 50s and 60s. Today, no one under the age, thank God, 25 years of under, have passed away from COVID-19. However, 39 people under 25 have been hospitalized due to COVID. 6 of those spent time in the ICU. Of all the deaths contribute to COVID-19, under 5 are those between the ages of 25 and 49. And again, since the start of the pandemic, over 200, or I should just say 206, to be precise, people between the ages of 25 and 49 had to be hospitalized, and 13% of them spent time in the ICU. Of the total deaths, 91 were among residents between the ages of 50 and 74. This accounts for 30% of all deaths. 652 people in the age bracket have been hospitalized to date, and nearly 50% of all hospitalizations. And of those hospitalized, 19% were placed in ICU. Sadly, 207 of the people that passed away have been from this COVID-19 are between the ages of 75 and above, 68% of the total deaths. 489 residents over the age of 75 have been hospitalized. As of today, there are 17,637 cases of COVID-19 in Albany County to date. That's an increase of 192 positive cases since yesterday. This brings our 5-day average to 187. Yesterday it was 199.6. Currently, 2,742 people are under mandatory quarantine. Yesterday there was 2,504. Of the new positive cases, 67 have had close contact to a positive case. 14 are healthcare workers or residents of a setting. 111 don't have a clear source of infection. As of today, 53,513 people now have completed quarantine. Out of those, 16,050 tested positive for the virus and have recovered, which is good news. 234 recoveries since yesterday. There was an increase of 7 new hospitalizations overnight. That brings us now to 163 people currently hospitalized by the virus. Yesterday was 169. 16 patients currently in the ICU, stays the same as yesterday, 16. I'll say this, we need people to continue to wear a mask, cough into your arm, clean your hands, and stay 6 feet apart. This is not done with us. We have a long way to go. I applaud the president for taking this ambitious or a fast approach of trying to get 100 million vaccines out to people in 100 days. It's coming, but it's still going to take to summer under that plan. If not, we're looking well into the fall before everyone gets vaccinated. And I do want to remind people that 117,000 people, 640 got the first dose. 90,000 got the seconds. For like on the New York State website, it's about 77,000 in the Capital District. There's 1 million people that live in the Capital District, so think about the math behind it. We still have a long way to go, and it's going to take time, and people have to be patient, and they have to wait their turn, and we'll get through it. But you have to wait your turn. So I will say this: continue to follow the social guidelines. If you see the new K95 mask that I've been wearing, Germany made this where everyone now in public has to wear this mask on their mass transit and everywhere else. So you're seeing this more and more. No more, they're saying getting CDCs, looking at cloth masks and everything else, telling you double up. Listen to the experts, because they're seeing the new strain, and I'm not trying to scare everyone, the new strain of the virus. This is the only one that's going to help you, not the cloth. So please educate yourself, go online and do your research. You don't have to believe me. For those who want to get the vaccine, check their eligibility. Please go to the state website. The hotline's 1-833-697-4829. Make sure you fall in that category, and Dr. Whalen can talk about this with the upcoming pod, and how she said this before, they had to turn people away. You have to wait your turn. And I said this, and it took a lot out of me to even talk about my experience being in a war, and saying that the mistakes people make or decisions you make will haunt you if you have a soul a year from now. People that are butting the line and not waiting their turn or being selfish, let the vaccine get to the people that it needs to get to first. Please stop being selfish, because 8 months from now, you can justify it any which way you want, because I've run into people, and you can justify it, and you can talk to me till you're purple in the face. I'm not going to argue with you. I'm not. But you're going to have to live with yourself a year from now. Maybe not. Maybe you don't care. Maybe you only care about yourself, but you're going to have to live with yourself for what you've done. Wait your turn, please. Let's get the vaccine where we need it, to the essential workers, to the unions, to the teachers, and make sure it happens. You know, to the kids that are going out and getting the shots that work for, I don't want, XYZ organizations, and you know who they are, and they're part-time counsels. Wait your turn. You're 17, you're 18, you're 19. Get it into the arm of a senior, and every shot in the arm's one shot closer to us getting out of this. Look at it that way. So if it's not your turn and someone gets it, that means we're just one step closer to the end of the tunnel, to this nightmare's over with. I was joking around with a reporter the other day, and I really aged myself, and I go, I feel like it's the Bob Newhart show, and I'm just waiting to wake up, and it was a nightmare. And they go, who's Bob Newhart? And I said, I can't talk to you. And I had to walk away. But the reality is, it's not. It's here. Please wait your turn. Please educate yourself. You don't want to believe us. You don't want to listen to the message Dr. Whalen puts out there every day, and based on science and her being a medical doctor, then I don't know what to tell you. And I'm not going to argue with you if you don't want to wear a mask. That's your choice. But stay away from people. Stay away from people. You don't want to wear a mask? Stay away. You don't want to go into a store and put a mask on? Then please, by all means, don't go in that store. Shop online. That's a possibility. So we tell people to be patient about the appointments. It's going to take time. Hopefully now with the what President Biden's going to do and Governor Cuomo's been talking about, we're going to see more and more shots start coming here to New York State. But please call 211, the hotline, for getting information, and great partnership we have with United Way. They're also talking about, we've been into a lot of discussions how we can make this process easier for people that can't navigate the web, make it a simple number. I know Pete Gannon's been working not just with Albany County, Westchester, and other counties in the state to make 211 that, where people can just call and set their appointment up in their respective counties. But we're also working on a number that we're putting out. Unfortunately, I like to say, when I sat here last week, I was hoping it would be done quicker. The website, I was hoping that we'd have a number up quicker. It takes time, but again, there's no excuses. It falls with us, and I want to make sure, Dr. Whalen and I have said this from the beginning: transparency and making it easy and fair and equitable for everyone to sign up and not making it the Hunger Games. So you got to bear with us. This is our first week that we're controlling it ourselves, and it's going to change and evolve under the leadership of the Dr. Whalen's team at the health department, our IT in my office, and trying to make it user-friendly and easy, but also not bog Dr. Whalen and their team down, because they are doing a lot. And if we start to get more vaccine in and the plan that we have, they're going to be even busier. So you got to be patient with us, and we'll get through it. So one of the other things, and Dr. Whalen can talk about this a little bit more, was at the last briefing we talked about high-risk sports to move forward this spring. I want to assure everyone who's listening to this, please listen. You're not going to get the green light February 1st. So if you think sports are going to start open February 1st, it's not going to happen. I want to say I'll leave this to Dr. Whalen and her team. All the health commissioners have been meeting, or health commissioners, yeah, that's right, health commissioners have been talking, coming up with a plan. I've been working with Steve McLaughlin, Roy Foreman, Steve Bolger up in Saratoga, and all the other county managers or chairs that run the respective counties, the 12 of us, of having a group plan coming out in unity as one. Same message, same platform, same everything. So we're taking our guidance, and we're going to take this serious from our health commissioners. There's guidance from the CDC that's been out since day one. So, if you look at that, a 7-day rolling average has to be under 5%. We're at 6.2 as of yesterday.
4.
Or 4? Oh, sorry. Thank you. See, I'm going to let you speak on this. We're below, it has to be around 4% to have sports. So do the math, people. So if you want to play sports and you want your kids to have that experience, wear your mask, cough into your arm, clean your hands, and stay 6 feet apart. So there's going to be a lot of protocols that are in place, and we're not there under this matrix. And yes, our numbers are going down, our testing numbers, that positivity rate's been great. We're going down the slope again, I hope. I don't want to jinx ourselves, but it's going to take time. But unfortunately, the reality of the world is we're breaking records with people passing away these last 2 months. So please matter of fact, I'm going to turn over to Dr. Whalen and talk about it, because she's probably going to want to talk a little bit about this. But we can do this, getting together and getting the vaccine, and it's going to take 75% of us to get vaccinated. But you got to be patient, and we want kids to feel normal and everything. But I do want to thank Dr. Whalen and her team for what they're doing. And have been doing, and again, having this thrown at us unannounced was, it was difficult, but like I said, we will adjust, we'll make it work, and we'll go forward. We'll also be announcing, and Dr. Whalen, I'll let her do it because she deserves it. Our team will be launching our website, and she'll let you know the time, and you can sign up. I know it's the day before, and it was one of the things Dr. Whalen and I went back and forth with, but we didn't want to release it so people wouldn't know about it, because it fills up quick. It will fill up quick, and Dr. Whalen can talk about how quick that, our 800, slots will go very quickly, and we want to make sure we do it equitable, transparent, and give people an opportunity. Dr. Whalen.
Good morning. So yes, obviously right now it's an incredibly busy time with a lot going on. The first thing I want to talk about is the numbers. And over the past few days, we have seen a slight decrease in the overall number of cases, which I am being cautiously optimistic about. This, as you know, our rolling average for number of cases this week is decreasing a little, and we are following the numbers very closely. It takes a long time for me to be able to convey information that our rates are decreasing. So at this time, I'll say the numbers are I'm cautiously optimistic about the numbers, but I cannot say at this time our rates of disease are decreasing, because that needs to be a trend over a longer period of time. I also think it's an incredibly critical time when we're looking at the evolution of a more communicable strain. So we have to really watch what's happening right now and continue to act with an abundance of caution. We really want to make sure that we can keep our hospitalizations and deaths down and do the best that we can to ensure that people can protect themselves, and that we don't see a rebound of numbers. So all the behaviors that we've discussed all along remain very important. We are really pleased to be involved in the vaccination effort and getting vaccine out as quickly as possible. It has been discussed many times that, and this is going to be our third week of pods. So we are learning how the process unfolds. We find out usually when we're getting a shipment on a Sunday evening. We are told we are not able to schedule people until we know we're getting vaccine into our hands. Obviously, we don't want to give the public a false perception, and allocation is not under our direct control. So we find out how many vaccines we're getting, and then we plan for vaccination clinics, and thus far these clinics have been on Thursdays. The sign up for the vaccines is online. We are working closely with community partners. As all of you know, it is part of our core values and mission at the health department to ensure that we can provide equity of our services across the population that we serve. So we are actively looking into ways that we can increase the availability for those whom signing up online may not be an easy solution. And we are honing that process and look forward to sharing more information on that with you. At this time, today we will be launching our link for the clinic tomorrow. And it is very important for people to know that by executive order, there have been strict legal enforcement of who we can give the vaccine to. And this, at this point in time, is limited to the 1B essential worker population. If you want to know whether you are part of that population, there will be details on our website, and I can share with you now that includes first responders or support staff for a first responder agency, including fire, police and investigations, public safety communications, corrections, public K through 12 schools teachers, licensed, registered, approved, or legally exempt child care providers, public transit, individuals living, working, or volunteering in a homeless shelter, public-facing grocery store workers, in-person college faculty and instructors. There is more detail on our website. It's important if you sign up for our clinic that you know you have to attest to being part of this population. And as a further measure at our clinic, we have staff that ensure that an ID is provided. At this point in time, because of the supply of vaccine that we have at this time, it is essential that we follow this categorization. I would be very happy to give more vaccines, and we are hopeful in the future, as supply increases, we are going to get that opportunity. So in the meantime, I suggest people carefully review those considerations. If you want to know where your over 65 relative or yourself can get shots, that information is also on our website. Several pharmacies in the area, along with the mass site at SUNY, are current options, and we look forward as well to those options expanding over time. But the message at this point is still that people need to remain patient. We are working with the supply that we have, and we are getting it out very quickly. It's essential that people know that in the Capital District, we continue to work with our regional hub. All of us are accountable for the vaccine that we receive. All of us turn this vaccine over as quickly as we get it. There is no store sitting on our shelves. We get it out as soon as we get it. And so this is an important message to the public. And I know it's difficult to have patience for a lot of people. I know a lot of people are concerned about themselves and their loved ones. A lot of people are disheartened at the amount of time that they have needed to spend indoors and away from their loved ones and other activities. We're getting there, and it's important that people remain vigilant as we're in the home stretch. Finally, the decision on sports we will be sharing a communication later today with the school districts. This is something that we have, as I have often alluded to, these decisions are not made within a vacuum. We like to work with the New York State Association of County Health Officials, our other local health directors and commissioners, on determining evidence-based strategies so that we can ensure safe control of disease spread. I know that there will be a lot of people that are unhappy with this decision. It is a decision that has fallen to us, and as a local health official, as a physician, as a public health board certified physician who is able to look at the evidence that we currently have, and knowing that my decision will be based on caution, an abundance of caution for the students, for the athletes, and for the families and the schools. We will be releasing that guidance later today. It is dependent upon the weekly rate of positivity. As most of you know, we are coming off our highest positivity rates. We were in excess of 10%, and now we are hovering a little bit over 6%. The decision has been made that we will be looking at a weekly positivity rate of 4%. And this, along with other metrics, will be important for school administrators and team supervisors and coaches to be aware of. As I said, I am hopeful that our rates of positivity are decreasing. I am very hopeful that we are starting to enter a downward trend. But we cannot be reassured, and the past has shown us this. We had hopes in the summer and the fall that our rates would not start to climb again. And in fact, we went higher in terms of rates, hospitalizations, and unfortunately deaths than we ever had at the beginning of the pandemic. And I'll remind all of you that at our first shutdown, the New York State shutdown, we were working very closely at that time to ensure that our rates did not go above 1 or 2% positivity. So it's clearly a very different time, but the challenges really remain. So this decision has been put in the hands of public health, and as I said, we've weighed very carefully with colleagues and with the knowledge that we have, and that information will be going out and being shared later today.
Thank you, Dr. Whalen. And again, as I said to Dr. Whalen, I'll stand behind her decision. Because again, it's going to be based on the science, not based on votes or popularity. And this is about the safety of your children, and I get it. We need the. I know kids are struggling mentally, and I know they want to get back to some type of normalcy, and we want that too. And again, to all the parents out there that just want their kids to have their senior year or any time playing sports to forget about what's going on around them, I hear you, and I totally agree with you, but let's just make sure it's safe, and that's all we're saying. We want a partnership with the school districts. We want a partnership with all the sports organizations out there to do this safely. We're not saying no, but there's going to be a matrix, and we're going to do it safe, and we're going to do it together as a partnership. So please bear with us on everything else. One of the other things, switching gears a little bit, I was talking to County Legislator Gary Demolowitz, and reminded me of something we did in 08-09 with the recession, or we looked at, and I was talking to Chairman Andrew Joyce, but Gary, thank you, and Andrew, as always, thank you. It takes partnerships, and it takes people working together to come up with solutions. So one of the things we talked about, I know it's difficult for people right now to put food on their table, pay their rent, pay their mortgage. That's why we secured that $9 million for landlords and for people that can't pay their rent. So there's a lot of things we have to get set up. Just be patient with us, but that application is going to get out, and it's going to pay up to 15 months of rent, and for electric and for heat. So, we are making a difference, and I want to again thank my team for that. But to make another difference, and to Gary, to Andrew, to everyone that's been working on this, and one of the things we looked at in my office too, we have authorized Albany County a 5% reduction on penalty interest in September 2020 for schools taxes bills unpaid as of November 1st. It's a little bit, it's not a lot, it's something. There's some guidance that you're going to have to go through. You're just not automatically going to get it. You got to fall into a certain category, and then again, it has to be affected by COVID-19 and everything else. So it's going to be 5% reduction in penalty interest September 2020 school tax bills unpaid as November 21st. This reduction only applies to 2020 school tax bill paid in full before July 1st of this year. So you'll be able to pay installments. Those who are eligible will receive letters in the mail with future instructions for the next few weeks. So again, keep an eye out on it. We are going to mail you. We're going to let you know. Again, we want to be part of the solution, not part of the problem, and working together. It's one of the reasons. Look, we lost over $19 million in sales tax revenue last year in Albany County. We'll see how this quarter goes, and it's going to be a loss for a lot of people. It's our obligation now to work with the landlords, the tenants, the business owners, the bars and restaurants, hotels that are going to be devastated, to get through this. And that was one of the reasons why I built up the reserves that I did, over $60 million for this thing. Not to do pet projects, not to do things that unnecessarily spend that money. And there's an argument I've had for years with legislators, and they're like, let's do tax reductions, let's do this. No, this is why this money's here, to help people now at the most difficult time, not tax our way out of it because we can't, to work with people and to work with the county residents to make sure we hold the line on taxes and everything else in these difficult times. And it's going to be a while till we get out of it. This year is going to be tough, and 2022 is going to be even tougher. So bear with us. We'll get through it. Again, please, we're in it together. Anyone that needs a test, we encourage you to go out and get tested. Whitney Young, as always, 518-465-4771. We cover the cost as always. UAlbany, 188-364-3065. Go to albanycounty.com. You can see the test sites and the ones that are closed, which ones provide testing for children, average wait time, and please, as always, call our mental health support hotline. It's available 7 days a week from 8 a.m. to 5 p.m. 518-269-6634. Our 24-hour sexual assault hotline number, 518-447-7716. So, it's alarming because we've been looking at a lot of the numbers with what's going on in different agencies. During the spring of last year, the number of sexual assaults reported in the region and the state dropped last year. That was a problem, since this means sexual assaults weren't being reported, likely at a fair or confinement or being shut down for 4 months. People weren't reporting it. But since July, we've seen those numbers going back up again. Through 2019, there were 333 reports of sexual assault in Albany County. It dropped down to 224 in 2020. However, trips to the emergency room increased 558 in 2019 to 635 this past year. So they were going to the hospital, but they weren't reporting it. Maybe at a fair, being shut down in the same house. And it's one of the things Karen Ziegler and her team, think of them every day for what they do, getting out there and doing it. So I'm happy to announce that our Crime Victim Sexual Violence Center has expanded its hours. We're offering the online chat feature. Sometimes it's easier now. We're going to make it easier to text or message on a computer instead of talking over the phone. So in fear of them talking on the phone, we're going to have a little app. You can text and you can get right to a counsel and you can report what's going on. A trained crisis counsel will be available Monday through Friday, 10 a.m. to 2 and 4 p.m. to 6. The feature is also available on our website at albanycounty.com, CVSVSC. It's a large red box on the right-hand side of that, and you can click on that and you can just send us an instant message. It will not be shared, and you'll get the help that you need. So please know that we're here for you if you need us. 211 as always, in the 883-643-3065. I know it's a lot of data and stuff we've thrown at you, but I feel it's important to get as much information as we can out there to people so they know what's going on.